I was in secondary school in Form 2 in rural area. My mother could not afford to pay my school fees anymore. My elder sister told me to come to Nairobi to continue school. On arrival in Nairobi, I found my elder sister wanted me to be taken by her husband as her second wife. Only then she could take me to school. I refused. My sister's husband brought me another man who was a widow with 2 children. I refused and ran away to a friend, and we sold shoes in my friend's store. I met my husband who was working in a nearby restaurant. I learned tailoring with his support and found a job in Kibera where we lived. We got married and had 2 children. One in 2008 and 2009, I was negative. Shortly after my second child was born, my husband developed a cold and cough that never got cured. When I asked him about it, he started disappearing from the house. He became very ill and bedridden. I asked him what he was suffering from. He never told me. I suspected he was HIV positive. I went to DC Health Center and tested HIV positive. I went back to my husband and told him I was HIV positive. I tried to convince him to go for testing and get medicines. He refused. He told me that I can take the medicines and take care of the children. I suspect he knew his status and also had medicines because one day I saw the drugs in the toilet. I think he died because he never took his drugs seriously. My brother-in-law asked me to live with him. We are not officially married, but he acts like a husband. He looks after me and my children. He convinced me to go for treatment. In public health facilities, the nurses have no heart. They have no medicines. They don't keep secrets. And they refer you to a place where you have to pay. I went to CDC. My CD4 was still very high. I was put on Septrin. Family planning at CDC is not free for people who are not on ARV. I needed family planning because my new husband refused to use condoms. I have taken family planning from MSF. The health center is free and close. When I started bleeding, I decided not to go for another injection. A month later, I decided to try the injection again. I went to another clinic called Shofco. I was not given the injection that same day, but I was given an appointment. A week later, I was told I was pregnant. I did not believe because I did not feel pregnant and I did not want to get pregnant. I went to CDC for another pregnancy test. It was positive. I went to a chemist for another test. It was also positive. I started vomiting and stopped eating. I went back to CDC. My CD4 had dropped. I was put on ARVs. Now I'm okay. I wish my government would provide people in Kibera with good and free health services in one place and with doctors and nurses with a good heart.